Right, I hope you feel like you did much better in that second session. You have a little job to do now to see, I'm sure you're quite eager to see how you did. You basically have to mark your answer sheet, and you'll have to mark both your second part and your first part. And what I've done is I've put the expert interpretation answers on screen for you, and you can basically run down from 1 to 15 and complete what the actual answer was as interpreted by an expert, either A, B, or C for each of the X-rays. So please take a few minutes to do that. Please mark both the pre-teaching and the post-teaching session according to this mark sheet. Okay. So you use a tick or a cross in the answer sheet to do your marking. Indicate whether you've got it right or wrong. Then, of course, I want you to add it all up and see how you did, how many you got correct. I also specifically would like you to see how many of the TBs you got correct, which means is you have to add up all the times you chose A and were correct in choosing A. And this is an indicator of how often you picked up all the TB cases, both before and after the test. The expert answers and a snippet of explanations for each of the X-rays will follow as soon as you've done your marking. Right, so now I'm going to explain to you each film in detail, the reasons why I, as the expert interpreter, have decided on an answer. So here we go. I know I look like an idiot, but you have to take it that for this purpose, I'm supposed to be the expert. So number one was called A, as you've marked on your sheets. I chose this answer because the left hilum, as you can see here where the arrow is not an open V. It contains structures within it, a soft tissue density. And if you're not convinced, you can look on the lateral X-ray where there's almost a complete donut. And of course, I use the arrows on the structures at the bottom half of the donut because those represent the lymph nodes. So just on the presence of lymphadenopathy, we would call this tuberculosis. I called this normal for obvious reasons. There are no bulky masses at the hilar. There's no donut sign on the lateral. And there's no bronchial compression seen if you look through the heart. I called 3 tuberculosis. I think it's pretty obvious to all of us that there's lobulated masses at the right hilum, and you basically do not see the open V of the vessels. I also point out to you that the left main bronchus is extremely narrowed, which is an indicator that there might be lymphadenopathy behind the heart. And of course, if you don't see this donut, I probably haven't taught you very well because that is the donut I used in the teaching section, and it's the most obvious donut I have in my arsenal of X-rays for you. I call this inconclusive. Of course, this is an abnormal X-ray. You've lost the cardiac margin. That was the silhouette sign we spoke about. You've got density in the lung, which a lot of you can see. And this is a typical location for a right middle lobe airspace process or infection. But there are no obvious lymph nodes. And even if these are hidden, I have no confidence to say there are lymph nodes. So for me, this is an abnormal X-ray. It probably indicates infection, but it's inseparable from any of the common infections that you would get. So it's abnormal infection, but I can't separate from TB. That's a B. Here, this would look like an abnormal soft tissue mass, paratracheal. And at first glance, I also thought this is a really good example of paratracheal lymphadenopathy. But if one uses the lateral, and I haven't done much detail telling you to look at the posterior, anterior, middle mediastinal, but if you do look at the lateral, you will see that the soft tissue density is at the back. Now, this is a differential diagnosis, including neurogenic tumors, other developmental structures, and is probably not a lymph node site that's recognized for TB. Now, I'd be very happy if you called it inconclusive, but if you did call it possible TB or probable TB, I'd be very happy with that. The real answer is inconclusive B. This is patient I called normal. You can see the hilum very nicely because the patient is slightly rotated. There are no bronchial compressions and definitely no oval masses or donut sign on the lateral. I call this TB. I've outlined with 3 arrows what I think is a parahilar mass. And of course, I've got a lot of confidence in that because I've got the bottom half of a very skewed donut, yeah? So the lateral is very convincing in my opinion. I didn't put an arrow on it, but I don't see an open V of the vessels here. I suspect lymphadenopathy on the left also, but I have enough to call it just on the right-sided pathology. Right. 8 for me is tuberculosis diagnosis. I see, just like you do, there's airspace disease or pneumonia in the right upper lobe. I see that the cardiac margin is not clear. So these are all parenchymal abnormalities that can happen with both TB and other infections. The giveaway for me is this left hilar mass. You see it's lobulated, it's convex outwards. There's basically a cauliflower, as I've shown you, sitting in the hippopotamus mouth. And if you like, and if you're comfortable with the lateral, I guess these are soft tissue masses also on the lateral. So for me, this is TB, mainly because of the frontal film on the left. Again, a normal X-ray, nothing going on at the hilar, no compressions of the bronchi, and no big mass on the lateral. So I'm comfortable with that. I called 10 a TB. Of course, we see the cardiac margin is missing. We see some density, and it's confirmed on the lateral. That's just parenchymal disease. Could be anything. So this is abnormal, could be anything, until you see the bronchial compression. And of course, look at the lateral X-ray where there's a big oval soft tissue mass on the bottom half of the donut. For me, this is TB, and I'll wait for result confirmation in this patient, and I would put him on treatment. 11 was normal, in my opinion. Nothing going on at the hilar, nothing going on at the bronchi, nothing on the lateral. 12 is TB, not because I see lymphadenopathy, but if you look carefully, and if you look carefully at the costophrenic angles, where there's less vessels, and if you look behind the sternum, where there are less vessels, you will see many, many, many little dots. This is a miliary pattern. You have to get used to it. There are other conditions that cause little dots on the chest X-ray, but in the situation we're working with, if you see this, it's probably miliary TB. I have a lot of trouble distinguishing this from lymphoid interstitial pneumonitis in HIV patients, but usually those patients have a good immunity, and I don't often have to make this distinction. 13 is TB because of this right hilar mass. If you look carefully, you'll probably see a left hilar mass sitting in the mouth of the hippo. And if you're good enough, you'll probably spot these oval densities on the lateral that confirm my diagnosis of lymphadenopathy and therefore TB. Second last case I called normal. I think this is a vessel, and there's an open mouth of the hippo. I don't see any oval masses on the lateral. And now for the last X-ray. Of course we have masses at the hilar, and of course we have mediastinal masses, and of course these are visible on the lateral also. The question is this TB or is this lymphoma possibly? Because these are massive lymph nodes or very large masses. I cannot make that distinction, and every now and again we call a lymphoma tuberculosis. When the diagnosis of tuberculosis hinges on identification of lymphadenopathy, then I would call this TB until proven otherwise. So for me, this is TB until something comes and tells me that this is a lymphoma. Of course, I'll rely on my clinical tools, etc. So please check and see how well you did and see all the cases that you had some problems with. And I hope this was a useful talk for you. I hope you did well, and I hope you can go it alone in the field. Thank you very much.